Hello and welcome back to the Healthcare Motivation Channel. Today we will be talking about layoffs in healthcare. Have you heard of any downsizing or layoffs at healthcare organizations in your area? If so, tell us about it in the chat. If you find value in this message, please like, subscribe, and share this video with a healthcare professional to encourage and uplift them as they care for others. Across the United States today, a multitude of hospitals and healthcare organizations have announced layoffs in 2025 alone. From Emory Healthcare in Atlanta to Vanderbilt University Medical Center in Nashville to Kaiser Permanente in California. At first, these headlines bring fear. But what if I told you that every healthcare layoff also carries an opportunity? An opportunity for growth, for resilience, and for positioning yourself to thrive in the healthcare of tomorrow. First, it is important to note that healthcare layoffs are not new. That's correct. Healthcare layoffs are not new. In fact, since the 1990s, research from Health Affairs and the Journal of Healthcare Finance has noted recurring cycles of downsizing tied to reimbursement pressures and changes in Medicare and Medicaid funding. But what makes today different is the aftershock of the COVID-19 pandemic. During 2020 through 2022, U.S. healthcare spending peaked at over $4.3 trillion, according to the Centers for Medicare and Medicaid Services. Hospitals expanded staffing rapidly to meet pandemic demand. Now, as patient volumes normalize and financial aid dries up, systems are under severe cost pressures, thus leading to today's restructuring and layoffs. A 2023 JAMA Health Forum review highlighted that the pandemic created unprecedented workforce volatility, with entire categories of staff hired quickly, then shed just as fast. The numbers behind the layoffs. Nearly 5% of CentraCare's workforce, over 500 employees, were cut in 2025, including some patient care roles. A Journal of Health Economics study found that after the 2008 recession, hospital layoffs increased by 24% nationwide, showing how economic shifts ripple into healthcare. According to Health Services research, hospitals experiencing layoffs saw a 6 to 10% reduction in administrative roles on average, compared to much smaller reductions in direct clinical care, thus pointing to systems trying to protect bedside providers. A 2022 report in Medical Care Research and Review estimated that healthcare layoffs affect over 150,000 jobs per year in the U.S., with non-clinical staff twice as likely to be eliminated. Vanderbilt University Medical Center's 2025 announcement revealed 650 job cuts tied to federal funding reductions, illustrating how policy change directly impacts job security. Together, these numbers show healthcare isn't shrinking overall, but the shape of the healthcare workforce is being remodeled. Why this matters for you? This matters to you because right now, employees hear the word layoff and think, I could be next. But in reality, layoffs don't end careers. They are inflection points on the career journey. Healthcare organizations aren't removing value, they're restructuring value. This means opportunities are shifting. Where administrative roles shrink, the demand for multi-skilled, flexible healthcare workers grows stronger. High-impact strategies. Here are 3 strategies every healthcare worker can use to remain valuable, pivot, and thrive. 1. Build hybrid value. Be irreplaceable. A 2023 Harvard Business Review article highlighted that healthcare workers who combine clinical expertise with tech literacy are 60% less likely to face layoffs. Learn electronic medical record (EMR) optimization, such as navigating, managing, and optimizing EMR/EHR systems efficiently for accurate patient data entry, retrieval, and analysis. Learn telehealth systems, such as managing digital patient monitoring tools, such as wearable devices. Learn about AI-assisted care, such as using AI to triage patient symptoms or risk factors, prioritizing urgent patient cases. If you can merge soft skills with patient care and digital tools, you increase your chances of becoming a must-keep employee. 1. Pivot toward growth sectors. It is important to note that not all areas of healthcare are shrinking. According to the Bureau of Labor Statistics, jobs in telehealth, home care, and behavioral health are projected to grow 13% from 2022 to 2032, which is much faster than hospital-based roles. Upskilling in these areas enhances opportunities for growth and value for the organization. 1. Invest in networking and continuous education. A Journal of Career Development study showed healthcare workers who actively engaged in professional networks were 40% more likely to secure re-employment quickly after layoffs. Certifications in leadership, specialty care, or informatics not only open internal promotions, but can increase value in the organization. Many healthcare workers may want to know if this the end of job security healthcare? No. The truth is, healthcare isn't dying, it is evolving. Systems are moving from inpatient-heavy, administrative-heavy structures to a leaner, digitally powered, patient-centered model. Those professionals such as clinicians, support staff, leaders who adapt to change will not only survive, but will thrive. So, if you're a healthcare professional, don't let layoffs define your value. Grow in knowledge. Be intentional. Network. Be solutions-oriented, not a complainer. Refine your skill set. Every challenge is a chance to pivot, to learn, and to reinvent your role in this ever-changing, life-saving industry. Thank you for tuning into the Healthcare Motivation channel. If today's message inspired you, please click like, subscribe, and share this video with a friend or colleague who could use an encouraging word today. Your encouragement could be the boost that someone needs to keep going strong in their mission to care for others. Stay motivated, stay connected, and we'll see you in the next video.